Okay, we are recording. Hi everyone. Today's webinar is Ransomware Attacks, What Medical Librarians Need to Know. Closed captions are available in the link in the chat. And my name is Margot Malachowski. My pronouns are she, her. I'm an education and outreach coordinator for the network of the National Library of Medicine in Region 7. Region 7 serves Connecticut, Maine, Massachusetts, New Hampshire, New York, Rhode Island, and Vermont. And our office is located at UMass Chan Medical School in Worcester, Massachusetts, which is the heart of the Commonwealth, as they say. This webinar is being offered nationally, and we are recording on December 9th, 2021. All attendees are muted, but we welcome your questions and your comments. Please make comments in the chat, and if you look at the bottom of the right of your screen, you should see the word chat and a little conversation bubble. Open that up and you'll see the chat box. Please make sure you're sending to everyone or all attendees. Rebecca Brown from our National Training Office is here with me today to help me keep an eye on the chat. And if you send it to everyone or to all attendees, both Rebecca and I will be able to check on that. All registrants will receive a link to the recording, and the recording will be available on the class description page. And I don't know if Rebecca can drop that in the link.
One sec on that.
Yeah. And also, Alice will be talking about some resources at the end that are specific to librarians, and we'll make sure that's available as a handout on that page too. And I hope to make the recording available over the next 2 weeks. I try to get it done quickly, but there's always, a chance that I get bogged down. So before we get into today's topic, a word about who we are. The National Institutes of Health is the nation's leading medical research agency. The National Library of Medicine is an institute at the NIH. NLM is the world's largest biomedical library, which produces information resources such as PubMed, clinicaltrials.gov, and Medline Plus. NNLM is the network of the National Library of Medicine, and we're the outreach program of the NLM. The network operates out of 7 regional medical libraries, or RMLs, and the RMLs offer education and funding opportunities to support equal access to biomedical information. And so those are all of our acronyms. And I mentioned in my introduction that I work in Region 7, and maybe Rebecca could drop the link for where you can find your regional medical library. So I am thrilled to welcome you to a webinar on this critically important topic of ransomware and how it might impact library services, medical library services. So on January 11th, 2018, Hancock Health in Greenfield, Indiana, experienced a ransomware attack on the hospital's information systems. The hackers used compromised account credentials to target a server located in the emergency IT backup facility, and this caused havoc with critical information systems. So in today's webinar, Steve Long, the CEO of Hancock Health, will talk about his experiences with mobilizing disaster response procedures. The University of Vermont Health Network in Burlington, Vermont was attacked on October 28th, 2020, with malware infecting hospital information systems. Alice Stokes, research and education librarian at the University of Vermont, will address the ways that library services are impacted by ransomware attacks. So today's objectives are to prepare medical librarians to describe disaster response procedures to continue hospital operations and to identify how ransomware attacks could impact library services. So we hope to prepare you to initiate plans for responding to ransomware attacks. This webinar is part of a series that addresses access to information in disaster situations, and each webinar focuses on a different topic with a guest speaker. The series provides continuing education that applies to the Medical Library Association Disaster Information Specialization. So I am going to turn it over to Steve now. Let's see, there you go.
Okay. Well, thank you very much for the invitation to join you. It is a pleasure to be with you today. So let me share my screen here and see if we can make this work. All right. And can you see us okay, Margo?
Yes.
Wonderful. Well, again, my name is Steve Long. I am the CEO here at Hancock Health, and we are located in Greenfield, Indiana. You may not know where that is, but we are right outside of Indianapolis. Yes, the very home of the Indy 500. So perhaps you've been here. If you've not, I would encourage you to come and visit us this next May for the largest sporting event in the world. But we are located just east of Indianapolis, and our service area is essentially East Central Indiana. And we are not a large health system. We're sort of a small to mid-sized system. We have about 1,400 employees now. We have about 20 locations, and we bill out about $1 million a day. So it's one of the figures I want you to keep in mind, that every day we bill out $1 million for the services that we provide. An important thing to know. Now I'm going to talk about the journey that we went on just about, well, back in 2018, getting farther into the past as we go and as I get older. But our time together is going to be driven by these elements, and I will hit each of these very quickly. So I would encourage you to put on your seatbelt. We're going to be going pretty quickly through this information. So I want you to know that going into this incident, we were pretty averagely prepared for something like this. So we had done many of the things that you would expect. We had a technology company that was watching our network. We had actual software watching our network for intruders. We had our network penetration tested every year. We were ready for these kind of things. We had anti-malware, antivirus running on our system. We had invested a lot in IT. We were most wired at the time 3 years in a row, and I think we're 5 or 6 years in a row now. We had a comprehensive privacy and security program, and we had support from the C-suite and the board for privacy and security. So we were pretty averagely prepared. I mean, my goodness, we were even doing those fake phishing emails, you know, that your IT folks send out trying to get you to click on a link. We'd been doing that for a while. So we thought we were okay, you know, and it was always something that you read in the journals and said, wow, I sure hope that never happens to us. And it's always going to happen to the other guy. So for this particular incident that I'm going to talk about, a few things to know is that we were heading into a holiday weekend, meaning that the banks were going to be closed the following Monday. So keep that in mind. It's relevant. And we were expecting a snowstorm the following day. So this actually happened on a Thursday evening. On Friday, we were expecting a snowstorm. And we were also in the midst of kind of a busy flu season. Now, it's kind of hard to remember flu seasons in this whole era of COVID, but we did have those in the past. So we were expecting a weather emergency. We had done things like printed out our patient lists for the next day, and we were kind of ready for people not to show up. So just know that's how we were situated. So it was about 9:30 that Thursday evening. I was at home in bed, and I would say I go to bed early because I have grandsons. You know, when you have grandchildren, they wear you out. So I was going to bed early. And I got a call from our administrator on call. And he said, look, I don't want you to worry, but there's something that happened to a computer in the lab. There's something going on. And as I was lying there in bed, I began to get copied on messages on my smartphone because we have a secure messaging system called Diagnodes. And I was copied on messages from our nursing leaders to our chief nursing officer saying, hey, there's something going on with our computers up here. And I thought, well, this is not good. So I decided to go in and meet our administrator on call. And when I arrived, what I discovered is that we had messages on our screens. And in fact, I'm going to show you a picture. This is an actual picture of the screen of the message we got. And it essentially said, we have encrypted your information system, your network. You have 1 week to purchase the decryption keys or we will wipe everything out. And in fact, when I walked into my office, these are actually screenshots of the actual file names. Every file name that we had was changed to either sorry for files or we apologize. And for a moment I thought, well, you know, these aren't that bad of people because they said they were sorry. And then I recalled that everything was locked up. Our entire network was locked up. So I can tell you as we went into this, we had 3 general principles in mind. It is not like we sat down and said, hey, what should our guiding principles be? But these were the guiding principles. So number 1, we wanted to make sure that our patients were safe. I had visions as I drove in that night that perhaps we had something on the network that had migrated its way into our patient-connected equipment like ventilators and IV pumps. Now, that is not the case. It never made it there. I'll talk more about that in a moment. But patient safety was top of mind. The security of our information was secondary, and I had this vision of our information already out on the dark web and for sale. And then finally, time to restoration, because we need the information systems that we have, and the more quickly we can get them back up, the better off we would be. Plus, as I mentioned, we bill out $1 million a day for the services that we provide. So these are the 5 response steps that we went through on our journey. I'm going to hit each of these in turn to help you understand what happened. So the first thing is that we decided that we should activate our disaster response plan because we have one of those, and we had one back then as well, and I'm sure you do. And the first thing we said is, well, if this is a virus that is propagating its way through the network, we need to shut down our network and shut down all our computers. So we shut all of them down. Manual process, had to send people out to all of our offsite locations as well and physically turn them off. Now, I'm going to share some lessons learned as we go along, and one of them is you don't actually want to shut them all off. You want to disconnect them from the network, but if you shut them off, it's a virus, and you lock the virus where it was. But in fact, the forensic IT folks really need to see that live version of the virus. So here's a lesson learned, is that we should have disconnected everything, but in fact, we shut them all off. Put signs all over our building saying to our employees, please, whatever you do, don't turn them back on. And then we stood up our incident command center. And I want you to imagine, it is the conference room that's near my office. And it was the middle of the night, about midnight. We all in that room looking around at each other, and we had zero connection to the outside world electronically. In fact, the only connection we had was the hotspot on my phone, my personal laptop, and my personal email address. And that's where we started. So one of the things I would encourage you to do is practice starting from there, because that's maybe where you're at. We decided, of course, that the first thing we needed to do was let our board know what was going on. So I went to the place where I keep all the contact information for my board, which was my computer, which, as you recall, was encrypted and locked up. And so we quickly figured out that we actually had access to electronic resources that did not reside on our network. So one of those was a board portal called Board Effect, and I was able to get the information and contact our board. And then we needed to let our employees know what was going on, and we actually had a separate system. It was called Live Process that lived on a separate network outside of our organization. So we logged in there and decided to send a message to everyone. And what we quickly remembered is that when we set up the system, we gave our employees 3 choices. One was you can be contacted by your home phone, by your work email address, or by your cell phone. And wouldn't you know, everybody had picked their work email address. So we had to revert everybody to their cell phone so we could communicate. And then finally, we needed to communicate with our clinical staff, and we had a separate system called Diagnotes to do that. So the learning here is that even if you think you have nothing, you actually do have access to resources that you may not consider to be relevant, except in a situation like this. They were there, and they were very, very helpful. So the next thing we did is we made sure that we were taking good care of patients, and in fact, we were doing that the whole time. We made sure that there was nothing on our patient-facing equipment, and there wasn't. And then we moved all of our staff to paper. So you probably all have these paper documentation systems that you can fall back on if your IT system should fail. So did we. Only when we usually do this, it is for 1 hour a month on a Tuesday night at 2 o'clock in the morning when we do downtime procedures when we're doing changes to the system, which means the people during the day never practice. And frankly, many of the people we have are young and they never documented on paper. So another learning is make sure that people really know how to use the paper documentation that you have. Wow, that was an important lesson to learn. And you might also know that we went on diversion in our emergency room, but not for the reason you might think. The reason we went on diversion is because our imaging systems, while they could capture the images and store them electronically on the actual device, could not connect to the PAC system, to the picture archiving system, so that our radiologists, who are off-site often, could not see them. So we had to go on diversion until the radiologists could get here. The thing I want you to know, though, is that we never stopped being a hospital. We took care of patients. We admitted them. We discharged them. We did surgeries. We We had babies that were born because hospitals are people taking care of people. Computers are important, but that is not what we actually do. So the next thing is that we pulled out our plan and we did the logical thing, and that was we phoned a friend. And wouldn't you know that the very first thing in our policy said phone your attorney. So guess what? Your attorneys actually are friends. So we called them and they immediately put us in touch with a forensic IT company that was here in Indianapolis. And it is important to know we had pre-existing relationships with our attorneys and with this forensic IT company, but they were not actually impaneled by our cyber liability policy, our insurance company. So another lesson learned, make sure that you know who you get to work with in a situation like this. It may not be the people you already know. We established a call cadence that was appropriate for the situation that we were in. And then we made a really interesting decision, and that is to bring in the FBI. And I'll tell you, there was a moment where we paused when our attorney and the forensic IT company said, you need the FBI. And we thought, well, what's the FBI going to do here? Well, their role is purely advisory and investigative. They don't come in, they don't take over, they don't tell you what to do, but they do tell you what might happen based on the decisions that you have. And then, of course, we did our forensic IT investigation. And by we, I mean the IT experts, of course, not me, because I have no idea how this stuff works. And that has 4 stages. So you have to figure out what happened, identify it. And when it's a virus, you have to contain it, and then you need to kill it. And if you do not contain it and kill it before you turn things back on, then you're right back to where you started. I have heard these horror stories of places that did not do this, and they end up paying a ransom 3 times because they turn on their systems prematurely. And then you remediate, which means that you actually get rid of it off of your system and bring your system back online. You have to go in this order so that you do not reinfect yourself. So here's what we found actually happened. We had logs that were turned on in every piece of computer equipment we had. We had extraordinary logging, so we know exactly what happened. We had what we call an open RDP port, a remote desktop protocol port. This is an outside access because your system does need to be accessed from the outside by the various companies that you use. Unfortunately, this particular RDP port was open, meaning you could see it from the internet. Now, you still needed a login ID and a password to get in, but you could see it. Typically, you can't even see these. We also had the evidence that these outside perpetrators tried to get their way into the system, kind of like you see in the movies where they have this brute force mechanism they bring to bear where they put millions of combinations of login IDs and passwords, and we had evidence that it didn't work. And then sometime later, they logged in with an actual login ID and a password that we discovered belonged to one of our vendors. It was for sale on the dark web. Somehow they found it and they linked it up to us and they logged right in. So they logged in, they looked around our network a bit, and then they tried to load up the malware. In this case, it was the SamSam variant of ransomware, and our anti-malware and antivirus system actually stopped it. But here's the thing, another lesson learned is that when you have software protecting your system and you have actual human beings trying to break in, they can change the code. So they did. They changed it just enough so that it went past our anti-malware, and then it infected the system. Now, we also have this great logging, so we know exactly what they did. We know exactly where they went, so we knew that they didn't look at anything, nor did they take anything off of the network. What they did was lock it up. And it was helpful to have the FBI involved because they could tell us in their experience, these particular perpetrators were all about locking it up to get the ransom. So with the ransom, right, you may recall on that original screen, they said, we have tied up your system and encrypted your data, and you can pay us for the decryption keys. Well, that means paying a ransom. So do you pay or do you not pay? Well, the FBI will always tell you don't pay, right? Because it's a deterrent for others. If you don't pay, then maybe you won't get attacked or others won't get attacked in the future. But it really depends on the situation that you find yourself in. Do you have backups? Well, I will tell you, you may recall during the introduction that this attack actually occurred in our backup facility. So at the time of the attack, we didn't know if we had backups. Now, later on, we found out that we did. And then it's how long will it take to recover from backups? Now, I am a hospital CEO, which means I have CEO disease, which means that I'm not always right, but I'm rarely uncertain. So when we had spent all those millions of dollars on our IT system those years ago, I envisioned that we actually had a big red switch somewhere on the wall up in the IT room. And that if anything bad like this happened, we would run up there and hit the big red switch and we would switch to a different system and all would be well. Well, of course, it doesn't work that way. It takes a long time to recover from backup. And then what is the value of the time that it takes to recover? And then if you do pay, well, maybe do you make yourself a future target because they say, hey, that Hancock place they paid, we'll go after them again. Or maybe you pay and they don't actually give you your data back. Or maybe you pay and they say, well, hey, thanks for that payment. We'd like some more before we give you those decryption keys. The fact is, though, that this particular form of criminal activity relies on the integrity of the attackers. Because if you give them money and they don't give you the decryption keys, then the next person is not going to pay them. So it's weird how this works, but they're actually business people. They have a business model that they follow, and they're really quite good at making sure that the decryption keys do work. In fact, if they don't work the first time, they'll give you more keys until you find one that works. It's kind of amazing. Now, if you do pay, you pay in form of cryptocurrency, which in this case was Bitcoin. Now, I don't know about you all, but until the last couple of years, nobody knew what Bitcoin was, and certainly back in 2018, we didn't know, nor did we have any. And Bitcoin is not a thing that you just run down to the bank and say, hey, I'd like to get some Bitcoin. There is a process that you have to go through to get it. And then when you do get it, there is a process you have to go through to get it to the people to pay the ransom, to get the decryption keys. And it is not something that is quick. It can take a while. And when you do it, you have to do it on the dark web. So here's another lesson learned. Most of us don't spend time on the dark web. You need to have professionals that actually can do that for you. And then when you get it, you begin to wonder, how many keys is it? Is it one key that you get that unlocks your whole system? Well, no, it's not. In our case, it was 1,200. And then we had to figure out which computers the keys went to. It takes time. But I will tell you, in our case, it would have taken far longer to restore from backup. So, what do you do then? Well, I will tell you that there are legal issues here, and really the big one is this. Do you have evidence that nothing was taken? Because at the end of the day, this is really all about the release of information. And do you have evidence that nothing was taken, or do you just say, well, we don't think it was because we have no evidence that it was? Well, we had logging turned on. Another one of those lessons learned, have all of the logging turned on so you know exactly what happens, so that you have evidence of exactly what did or did not happen. That is what got us out of this, because I will tell you in the end, this turned out not to be a breach because we had evidence that there was no exfiltration. So just know all kinds of legal ramifications to this. Now, I want you to know that there are ways that you can try to defend yourself and not let this happen in the first place, although I personally believe that eventually it happens to everyone. So you need to have that response plan. You need to have an incredible incident response team that has these characteristics, and really the biggest one is selflessness. Because you can imagine our IT folks were mortified when this happened, and yet they put their pride aside and they did exactly the things that we needed to do to get ourselves out of the situation. And then you need to practice. So as I recommended earlier, lock yourself in the incident command room or the conference room where you're at and practice as if you have nothing, and then work your way back from there. Make sure you get cyber liability insurance. This is very important, although I will tell you it is much more expensive now than it was back in 2018. Make sure that you have protections written into the contracts with your vendors. You can imagine the conversations we had with the vendor that allowed that password and that login ID to be stolen. Make sure you have that login turned on. I talked about that. But the most important thing is this. If you have a team that does not function well on a good day, it is really not going to function well on a bad day. So organizational dynamics that are strong on a good day are what you need. Lessening the likelihood, you can read through all of this, but I will tell you all of those things that are annoying to you from your IT folks, like when they come through and they're patching everything, or when your computer restarts and you don't like it to restart, when you have to use multi-factor authentication. None of us like those things, and yet they are incredibly important, especially the very annoying emails that they send you to try to trick you, and the education that you have to do. If you happen to click on one of those links, I've actually clicked on those links, it's important to go through all of that because it lessens the likelihood of something happening. And then finally, make sure that you have the best of the best. We were averagely prepared before this. We are now far above averagely prepared because we have actual human beings monitoring our network 24/7. We have AI living on our network that is watching over our network and monitoring it and protecting it as well. We have the best of the best. And I will tell you that the difference between being averagely prepared and being really well prepared in terms of cost is not very much when you look at it as a percentage of your total business operations. So I will tell you, we went through all of this really in 3 days. Started on a Thursday night. We worked on it through Friday. By Saturday, we had the decryption keys. By Sunday, we had things up and running. Everything was back. Well, there was one exception. We had one server that was in the process of backing up at the very moment that we were attacked. And it was the server that had about a third of our Outlook calendars on it. And we never did get that calendar back. And I can tell you, it's actually a little bit freeing to not have a calendar because you don't know what you're doing tomorrow. And you can truthfully say, I don't know where I'm supposed to be. Now, here's one last lesson learned that I'll give you. Expect the unexpected. So here we are in the midst of this entire journey on the Friday afternoon, and I got a call from the publisher of the local newspaper. And he said, Steve, do you remember when you came here a few years back that I said that sometimes we might not print things in the paper that you like? And I said, yes, I do. Why are you calling? And he said, well, we've heard something's happening with your computers, and we're going to write an article. And we would like to have you comment. And I said, well, really, we'd love to do this on Monday. Could we do this on Monday? And he said, no, the word's out. We're going to put it in the paper tonight. So we made a decision to be very transparent with our experience. So we invited the reporters to come in. And as they came in and they started asking questions and we were answering them, they said, wow, this sounds just like Grey's Anatomy. Well, I can tell you, I don't watch Grey's Anatomy. I work in a hospital. I don't need to watch it on TV. And they said, yes, it's just like this. Well, I will tell you that the next day after I finally got to go home, and I can tell you, even a man of my advanced age can remain awake for 42 hours with the appropriate amount of Mountain Dew. But I finally went home, slept for a couple of hours, and I woke up and I thought, I probably should find out what they were talking about. So I found that episode, which had just started streaming, and indeed, there were these screens with these messages on them, and people had very worried looks on their face. And I thought, well, that seems about right. But then the FBI stormed into the hospital and took over, and I thought, well, that didn't happen. And then there was blood. We had no blood. They had blood. And a $20 million ransom. We did not have a $20 million ransom. I will tell you, our ransom was $50,000. So we decided to be very, very transparent to ensure that people really understood what happened. And that article was published in the local paper and was picked up by the Indianapolis Star, which was then picked up by USA Today, which was then picked up by the CBS News. And within a matter of days, it was all over the internet. In fact, I got a call one evening from one of my friends on vacation in Jamaica. And he said, Steve, what happened? I said, how in the world do you know? He said, it was on TV. And it culminated in this little picture at the bottom, where that is our hospital front entrance in the background with the guy with the mask and our logo right there. What do you do? Well, we celebrated. We celebrated because we survived the cyber apocalypse together. And all we got, of course, was the lousy t-shirt. But we also had the other t-shirts that said we were Hancock Strong, because together we did the things necessary to get through this in just 3 days. It was incredible. Well, I tell you what, that is the end of my story. And I know that there are some lessons learned that you are going to get now in how it relates to you in the field of library science. So I am looking forward to hearing this myself. And
Okay.
answer any questions in the end.
Great. Thank you, Steve. I am now switching over the presenter to Alice. I believe you should have the controls, Alice. That was great.
Okay. Okay, so hopefully now you are seeing my slide. Steve, I can see your face on the screen, so you could just give me a nod if you're seeing my slide. Okay, good. Thank you so much. And I learned a lot from that presentation, so really nice to be able to hear other people's experiences. So yes, my name is Alice Stokes. I work at the Dana Medical Library at the University of Vermont. And I'm going to tell you a little bit about our experiences and lessons, a few lessons that we've learned that hopefully will be helpful to other hospital and academic health sciences librarians. So in late 2020, the University of Vermont Medical Center experienced a cyber attack, and I'm going to discuss the attack, its effects, the recovery, and some thoughts for preparing for a cyber attack. First, just a little bit about the Dana Medical Library. So we are the medical library for the University of Vermont Academic Medical Center. We serve the University of Vermont Medical Center, the Larner College of Medicine, College of Nursing and Health Sciences, and the health needs of the whole broader university campus. We're physically located right between the hospital and the College of Medicine. You can see we are underground, so this is a picture of the exterior of the corridor that we are located on, which means folks going back and forth between the hospital and the academic side pass us all the time, so it's a good location. The library is part of the University of Vermont Libraries, so our systems are all on the university side of the network, and this had important implications during the cyber attack, some positive and some negative. If your library is a hospital library, true hospital library, meaning you are located within the hospital, both kind of administratively and physically, there will be some key differences in how a cyber attack would affect your system and services, but hopefully some of our experiences and lessons will be relevant to you as well. For a little further context, here's some background information about the University of Vermont Medical Center, which is the hospital that was targeted in the attack. And these are figures from our 2020 annual report. University of Vermont Medical Center is part of the UVM Health Network, but the cyber attack primarily affected the medical center, which is the main hospital, the main academic hospital at the center of the network. And that is directly affiliated with the University of Vermont and that we directly serve. So we have some health network hospitals that Dana Medical Library does not directly serve, but we do directly serve the hospital. And roughly the same size as Steve's hospital in the bigger scheme of things. Finally, I'd just like to place this kind of in the context of cyber attacks on healthcare organizations in 2020 and 2021. It was a particularly active time for cyber attacks, and many of them used COVID-19 themes, such as COVID-related domain names to exploit the COVID crisis for criminal gain. These all occurred against the backdrop of the COVID-19 crisis, which, as we all know, already placed tremendous strain on the healthcare system. According to the 2020 annual cybercrime report from the Herjavec Group, cyber attack costs were expected to reach $6 trillion in 2021. A 2020 retrospective report from the healthcare cybersecurity from the Health and Human Services Health Sector Cybersecurity Coordination Center reported more than 239 million healthcare cyber attacks were attempted in 2020. And in addition, HHS also reported that attempted attacks were up nearly 10,000% from 2019 to 2020. So this is just the environment that we were in when the attack occurred at the University of Vermont Medical Center, which was indeed cited in that HHS report about cyber attacks in 2020 as one of the noteworthy attacks from 2020, not the kind of a claim that anybody seeks out. So what actually happened? We first heard at the library that there might be a disruption to the network at the medical center on October 29th. It was first reported in the news around 11 a.m. when I happened to see a news alert and sent it to my IT person and said, "Hey, have you heard anything about this?" We did not receive any direct notification from the hospital directly because their systems were all taken offline as soon as the problem was apparent. And I'm sure notifying the library was not the first thing at the top of their list. However, on that morning of October 29th, we had all received from our hospital CIO this message saying, warning, there is a potential for ransomware attacks it's still not clear if this had already been reported, if the CIO, had heard from the hospital what was going on, but this was also during a wave of cyber attacks on hospitals in October 2020. So, but this was the first little inkling, and when I heard that news about the hospital, I thought, uh-oh, they must have known something was going on. So what were the impacts at the UVM Medical Center? When IT realized that there was a widespread problem, they shut down the internet, the Epic system, health records, everything to prevent any further infiltration, as Steve mentioned. The attack down to the phone system cut off access to staff emails and medical records and slowed the hospital's ability to provide radiation and treatment and run scans. So that was kind of the first inkling. And then a note was discovered on a network computer. Basically, it was just a text file that said, "We encrypted your data. If you want to get the key to unencrypt it, contact us," with some contact information. There was no specific ransom note or dollar amount, just that contact information. Medical Center immediately contacted the FBI. No effort was made to contact the attackers, and no ransom was paid. So as Steve said, there are kind of two schools of thought, and you have to choose one, and this was the decision that was made here at UVM. Some kind of details about the impacts. So all systems were down for several weeks. The hospital had to return to paper charts. Many appointments were canceled. Patient care continued throughout the whole time, but many, kind of standing non-urgent appointments were canceled. And also, as Steve noted, many hospital employees had never worked in an environment with paper charts, ever. So that was a huge challenge to just kind of day-to-day systems, and Epic was inaccessible. What did they do? The IT team wiped all of the servers clean and rebuilt them, and wiped and re-imaged 5,000 laptops and computers. The Vermont National Guard Computer Network Defense Team was brought in to assist with this process and provided essential technical assistance and personnel. During this period, UVM Medical Center furloughed and reassigned more than 300 employees, and the total cost has been estimated to be about $40 to $50 million. However, one bright spot, no data was breached. So that was the conclusion of all of the investigation. So no data was breached, nothing released. And kind of the big detective question, what caused the attack? So it was determined after several months of investigation, the cause of the attack was that an employee had taken out their work laptop on vacation, and they opened a personal email, a very normal, seemingly innocuous email from their homeowners association. It was a legitimate email from a legitimate company, but the company had been hacked. And when the email was opened, it deposited malware on the laptop. And then when the employee returned to work at the hospital and connected to the hospital network, the attackers were able to use that malware to launch the network-wide attack. And here's just a link to a news story about it. So that was just a little overview of what happened on the hospital side. So as I mentioned, I work on the academic UVM side of things, the university side of things. So that was all happening kind of on the other side of the divide. The library systems were all continuing, but we lost the ability to provide services for all of our hospital patrons. So here's a little timeline of kind of the total attack and then the total time to recovery, meaning the time that it took for us to reestablish access to all of the library resources for all of the hospital patrons. And the total time that took was nearly 3 months, 83 days. So the attack began on October 28th. The acute crisis at the hospital was resolved by November 23rd. So they started to get some medical records restored by the 12th of November. And then by the 23rd, they had restored all access to their medical records. However, on December 2nd, we discovered that hospital employees still did not have direct access to the library, and it took several more weeks to get full access restored. So I'm going to explain a little bit more about how library access was affected, what happened, and how we reacted and how we resolved it. So the special network connection between the hospital and UVM was severed immediately when they discovered the attack, and that's part of shutting down everything, which meant the loss of direct access to library resources from the hospital because Easy Proxy no longer had access to hospital IP addresses that are hidden behind a product called Zscaler. I don't know much about that. I'm not on our IT side of things, but essentially the hospital had implemented Zscaler, which hides all of their IP addresses from the public, but had given UVM permission to see those so that we could use Easy Proxy to give them access to all of our resources. So fixing this took much longer to troubleshoot and fix even after the main hospital systems had been restored because it required the cooperation of many different parties. The hospital, the university, the College of Medicine, all of the different parties that are involved in making these things work. Our relationship with the College of Medicine was particularly helpful in moving this process along because they really are such a key player between the university side and the hospital side, but it still took 83 days until the connection was reestablished. This meant that our usual authentication methods were disrupted, not only for kind of direct access to library resources, but to things like interlibrary loan and other places that we use those credentials to kind of verify who's one of our patrons and who's not. Like many academic medical centers, we have a mix of hospital patrons who, some of whom have university credentials. We use a net ID system, and some who don't. So a lot of the physicians also have university credentials and therefore could continue to access library resources. However, there are many hospital employees, nurses, other allied health professionals who do not have any university credentials and therefore had no access to library resources at all during this time. It also meant that some of the ways that we usually authenticate, like is the request coming from a medical center email address? Well, those people didn't have access to their email, so we couldn't use that as a kind of proxy for who's a hospital employee and who's not. So that made it difficult to provide even some of our other resources like interlibrary loan. It also meant that we had no way to communicate with folks. So as Steve was mentioning, you know, the ways that we're used to doing things, oh, we'll just send somebody an email. Well, that's not going to help if they have no access to their work email address. Medical center email addresses were not accessible for several weeks. We really had no other way to communicate with hospital employees directly. So in thinking about how we reacted, I came up with kind of 4 components that helped us respond. So we used flexibility, we searched for alternatives, we did outreach where possible, and we were really persistent in trying to find solutions and get everything back to normal. So for flexibility, we accepted requests from users' Gmail addresses, other personal emails, anything to kind of bend our usual rules. So if somebody sent us an email, put in an ILL request, or sent us an email asking for an article and it was from their Gmail account and they say they were a hospital employee, we honored that. We did not make them jump through additional hoops. Normally we're a little strict about those things, but this was a special situation. We sought alternatives. So we reminded folks who work at the hospital who maybe don't usually use their net ID, but that if they had a net ID that they could use that. We also encourage people to use things like individual accounts to databases. So for instance, if they had an UpToDate Anywhere account, they could use that to access UpToDate from any computer if they had another computer at home or on their smartphone. And we also emphasize physical library access for those who were physically at the hospital and could come in. Our library was open by then. We did outreach. So once hospital email was up and running again, we did send all of our liaisons, sent messages to their departments outlining alternative access and resources. And then persistence. We just continued to work until everything was fully restored. It took a lot of parties coming to the table and a lot of us kind of reaching out to folks and double checking to see if they had access. Until we could finally make sure that everybody had everything restored. Sorry. So every library will obviously have individual circumstances that determine how a hospital cyber attack impacts them. In our case, here are several kind of mitigating and also exacerbating factors. On the positive side, the biggest mitigating factor for us is that we are part of the university side of the academic health center. So therefore, in this case, our systems were unaffected because the attack was on the hospital and not on the university side. We, librarians and staff at the library, had full access to our databases, our subscriptions, our servers, files, email, all of the things that we needed. So that was really helpful. If people could get to us, we had access to things and we could get it to them. Timing of this attack was a little bit of a mitigating factor in some sense because it happened at the beginning of the second wave of COVID in Vermont, and clinicians were truly just so busy with urgent patient care that we just were seeing fewer requests for literature. In other words, clinicians were just too busy with essential care to be very focused on research. And most COVID literature was open access. So I think in some ways that reduced the effect of not being able to access library resources on a lot of clinicians. Also, in relation to COVID and timing, our physical library had reopened and clinicians could access our print collections and our online collections if they were able to actually enter the library. So the hospital is, the library is adjacent to the hospital. If they could come in physically to the library, they could access everything here. On the negative side, the biggest exacerbating factor was also our separate systems. This cut both ways. We were protected from the worst effects of the attack, but it also took much longer to restore the connection between the hospital and the library because our IT systems are separate. And while library resources are important to our hospital patrons, it was not at the top of mind for the hospital administration coping with the dual crises of the cyber attack and COVID, understandably. Similarly, timing was also an exacerbating factor. By the time the essential hospital systems had been restored, we were fully in the throes of the second wave of COVID in Vermont, and we couldn't enter the hospital to visit departments or provide other direct communication due to COVID restrictions. Fewer hospital employees were entering or even passing the library, so outreach options that might have been possible in normal times were just not available. And to further, the difficulty in communicating between the hospital, the library IT department, and the College of Medicine delayed the full restoration of access. I think if we had been part of either directly the College of Medicine or directly the hospital, there would have been fewer communication gaps. And finally, to wrap up, a few library-specific recommendations. So unfortunately, I actually have not found a lot in the literature specific to libraries and planning for cyber attacks, but there are many resources out there regarding cybersecurity and planning. And as Steve mentioned, everybody should have a cyber attack plan. You should review it regularly, and if you suffer an attack, reflect on it and update the plan. Since the UVM Medical Center attack was not on our network, and I'm not an IT specialist, I don't have specific recommendations, but I do have some recommendations compiled on the next slide with some resources for places to find that type of guidance. I would also suggest brainstorming alternative access options in advance, and if you have an attack happen during the attack. Some ideas that we came up with, so we asked patrons for alternative contact information. I would also recommend and hope that in the future we could have alternative contact information for patrons other than simply their hospital email addresses. If possible, encourage users to set up personal accounts for databases where possible. So for instance, our patrons who had up-to-date anywhere accounts were able to access up-to-date. This only helps if they have set it up in advance. So encourage people to set them up in advance and keep their access and passwords current. For instance, do you routinely let current or new employees know that personal accounts are available for some databases? Consider keeping key texts in print even when prioritizing ebooks, as we do now, but if physical print books do have an advantage over if you have a cyber attack. We also still had access to interlibrary loan and document delivery. because that lives on the university side of our system. So we encouraged patrons to request materials through our ILL form and allowed them to use alternate email addresses, such as Gmail for delivery of articles, including ones that we did have online in our journal subscriptions, but we were just doing document delivery for them. So consider asking yourself if any of these options would be available for your patrons. Finally, create a communication plan. So as Steve said, this was actually one of our biggest challenges because we're so used to communicating via email. So what options would you have to communicate with your patrons if your usual methods, for instance, email or your hospital intranet, were totally cut off? Could you make physical flyers, visit departments, or any other creative ideas that you may have? Here are a few selected resources related to cyber attack planning and specific to hospital and healthcare settings. And then I have a little bibliography and my image credits here to follow and my contact information. I'd be happy to answer questions during our Q&A or via email at a later time.
Great. Thanks, Alice. And Rebecca has put the link to Alice's resources in. We put it in a Word doc if folks want to take a look at that. So we do have time for questions. Thanks very much. I love the way your presentations worked together. I'm just seeing. All right. Okay, so we got one, Steve, all too often network security and IT are not well known for communicating changes to hospital departments like the library. We find out after the fact. For example, after IP address has been changed, used but unsecure modules are removed or access to Google Docs denied overnight. What do you suggest for departments such as libraries to get on the radar of the network of security so that we're proactive in our efforts and also aware of changes that might impact our access to things?
You bet. So first, I want to say that Alice, that was a great presentation. I learned a lot from that, so I appreciate the learning. The thing that I would say is that, as Alice noted, communication is the hardest part of this, and it is not just during a cyber attack; it's all the time. Because at the end of the day, everything is about relationships, right? Computers are great, but it's really about relationships between people. And so building a personal relationship between you and the folks in IT, I think, is the most important thing that you can do so that you can open up those lines of communication. I will tell you that we still have things happen that are not well communicated. So for example, the other day, we began blocking certain PDFs in outgoing email that would ensure that that email gets encrypted. We didn't communicate it well, and it happened to me. One of my emails got encrypted on the way out. So communication is always hard, but I think personal relationships and then working together to create an open line is the best. And can I make one other quick comment? Because I noticed there was a question that came up that always comes up, and it was about paying the ransom.
Yes, yes.
I knew that would come. And it is, yes, indeed, we paid the ransom, which means we purchased the decryption keys. It cost us 4 Bitcoin, which at the time were only worth about 12,000 bucks. They're worth a whole lot more now. And I can tell you that I philosophically, I am against paying ransoms. There is no doubt. I agree with every reason why you don't pay them. That said, it really comes down to a business continuity decision, and it is a different decision based on the situation that you find yourself in. Our situation was one where that was the right decision to make. I will not judge anyone for paying or not paying a ransom because you don't know the situation. And until you're actually in it, you can't really say what you should or shouldn't do. It was right for us, not right for others. I will also tell you that things today are very different than they were back in 2018. Back in 2018, all they were about was just locking up your system to get the ransom payment. Today, they are after your data because if you don't pay the ransom, then they want you to pay to get your data back. So it's a different world than it was. So frankly, we feel lucky that we were at the leading edge of all of this back in 2018.
Yeah. Okay, so Jordan Pike is sharing that they experienced a cyber attack at the end of October, still recovering and slowly restoring our services and online resources. Patient and employee data was breached. No questions, but could I reach out in the future? So Jordan, are you thinking? Yeah, go ahead, Steve.
No, I was going to say that I am happy to talk to anybody. You will find, as Alice noted, that there's very little information out there about real life attacks because people are very reluctant to talk. But we are not reluctant. We will tell you whatever you would like to know.
Excellent, excellent. Yeah, and somebody commented too, and I think it's great that we did, and as you said, Steve, yours happened much earlier, a few years ago, but this pay the ransom, no, not pay the ransom examples right here today has been very interesting to hear about. So did you experience the media coverage as negative or positive, Steve? And I guess Alice too.
Sure, I'll jump in real quick and say that you would think that it would have been very negative. The reason people don't talk is that there is reputational risk that's involved with talking. We did experience a little of that, but I will tell you that our decision to be transparent paid off big time in the end because people know what we did and they're learning from us and they appreciate the ability to learn. So overall, I'm very happy with what we did.
Great.
Yeah, and I think similarly at UVM, there was a lot of media coverage. If anybody's interested, if you do a Google search, University of Vermont Medical Center cyber attack, you will find lots of articles, mostly from Vermont Digger, which did an excellent job covering it. And there was, updated in the real time information, and they were clear, they even said we've contacted the FBI, keeping people updated. I think it's not a value judgment. Like Steve said, it's going to happen to, a lot of different hospitals. It's just there's only so much you can do to be proactive and protected. So I think everybody learns from hearing. And I also think patients would rather know what's happening, versus finding out later, what happened and they kept it a secret. So I think, it's going to happen. So you might as well cooperate and get your side of the story out there.
What we've learned, and I do want to just answer one other thing. So, did we make ourselves a target in the future? Of course, we did, and that is why we are as protected and as ready as anybody now because we have the most expensive stuff running on our network because we knew that we would be a target.
I have to say how disappointing that you don't have the FBI come sit in your IT, command center to help fix things.
Well, there were benefits to having them not here, but
in
relation to the FBI, if I could say one last thing, because the other thing people always ask is, did they ever catch who did it? And the fact is that the FBI did use our information and information from others, and they tracked them down, and they were two folks in Iran, and there is an extradition warrant out for these folks. And should they ever leave for a country that actually has an extradition treaty, they will be caught. That said, I have no indication that they will ever get to those places. So we know who did it, and they did not get caught.
Yeah.
And it's just not a simple calculation. I mean, just if the cost for our attack was much higher, but on the other hand, it's just not a simple. I just don't think there's not a simple calculation that you can do and get a perfect answer. So I think it's really interesting to consider all paths.
Yeah. Before we take any more questions, I just want to let folks know that Rebecca put the link to the evaluation for your CE in the chat. You have to use the whole, so even if your computer doesn't hyperlink the entire link all the way to the, what is it, the end of the link there with the AOU equals 0. Some people will get an error message when they've tried to click on that. So that's just one little housekeeping detail there. But so let me see if there's, we have a question, Steve. Did you sue the vendor that provided the breach?
We did not sue the vendor. And I will tell you that as we have worked with other vendors to get protections into the contracts, there is something you should know. And that is that they always want to limit their liability to the cost of that contract. So even though they may be the source of a multi-million-dollar cybercrime against you, if their contract is only for $10,000, that's what they want the limit of their liability to be. And frankly, we have not found a great way to get past that.
Okay, well, that brings us back to the top of the hour. Thank you so much. This is great. I'm glad that that you were able to join us, and we had a full house here. So thanks again. I'm going to stop the recording.
Thanks for watching. This video was produced by the network of the National Library of Medicine. Select the circular channel icon to subscribe to our channel, or select a video thumbnail to watch another video from the channel.